Does cervical intraepithelial neoplasia, CIN, mean you have dysplasia? Imagine discovering that some cells in your cervix are not quite normal but haven't turned into cancer yet. That's what cervical intraepithelial neoplasia, or CIN, is all about. It's a term doctors use to describe abnormal changes in the cells lining the cervix, which is the lower part of the uterus. These changes are called dysplasia, meaning the cells look different and behave differently from healthy cells but haven't invaded deeper tissues or become cancer. CIN is classified into 3 levels based on how severe these abnormal changes are. CIN 1, or low-grade dysplasia, involves mild abnormalities, often caused by infection with certain types of human papillomavirus, or HPV, especially HPV 16 and 18. CIN 1 can sometimes go away on its own without treatment. CIN 2, or moderate dysplasia, shows more noticeable abnormal cell growth and has a higher chance of progressing to cancer if left untreated. CIN 3, which is severe dysplasia or carcinoma in situ, involves abnormal cells covering most of the cervical lining but still haven't invaded other tissues. It's the most serious form of precancerous change, but even at this stage, it is not invasive cancer. The main cause of CIN is persistent infection with high-risk HPV types. These viruses are very common and often clear up on their own, but in some cases, they cause abnormal cell growth. Screening tests like Pap smears and HPV tests are essential because they help detect CIN early. Detecting these changes early allows doctors to monitor or treat them before they develop into invasive cancer. Treatment options depend on the severity of CIN. For low-grade changes, sometimes careful observation is enough, while higher grades might requiring surgical removal of abnormal tissue, such as through procedures like loop electrosurgical excision or cryotherapy. It's important to understand that having CIN does not mean you have cancer. Instead, it's a warning sign that your cells are undergoing precancerous changes. If these changes are identified early and managed properly, the risk of developing cervical cancer can be greatly reduced. Regular screening and follow-up are key parts of maintaining reproductive health and preventing progression to invasive disease. Always consult your healthcare provider for personalized advice and management options. Remember, early detection and appropriate care are your best tools in protecting your health against cervical and other reproductive cancers.